Welcome to the lesson on the pelvis. I'm going to share with you some things I think you're going to find extremely exciting. I'm going to share with you what I've discovered about the pelvis, and I think you will find it will help your practice and will make your treatments more successful and more dynamic. One thing to think about is that there's three bones. There's an innominate bone, a sacrum, and a second innominate bone. So the hip, the sacrum, and the hip. Now, because it's a right-handed world, when you lean forward, most of us lean with our right hand forward, whether it's a doorknob or a gear shift. That's very common. When that happens, this right side goes forward and up, and the left side reciprocally goes posterior and inferiorly. So when you then want to treat these two bones, the two hip bones, you have to consider how they will naturally move. So when this left side goes posterior and inferior, then you're going to contact the PSIS and the anterior inferior iliac spine. So you can move it forward. And the opposite happens on this side. So if this moves anteriorly, you're going to contact the anterior superior iliac spine and the ischial tuberosity, because it's like a teeter-totter, and you want to move it in both directions. So what we're going to do is we're going to work with how this bone goes forward and back in a teeter-totter fashion, and how we move this innominate or hip bone properly. Now, it's very easy. Using these techniques I've developed, you use the patient's innate mobilization and natural movement, and it doesn't take any force at all. It's very gentle on the clinician and gentle on the patient. So if this is moved forward and I want to move it back, I'm going to put my hand on the ASIS, the anterior superior iliac spine, and on the ischial tuberosity. And so to move it backwards like this, to move it posterior inferior, I'm going to say, would you please roll forward? That's good. And when she does that, I'm now moving the joint in a posterior inferior way. And then relax, please. Now we're going to do the opposite. So I'm going to put my hand on the posterior superior iliac spine and the anterior inferior iliac spine, which is really like the crest here of the inguinal line. Okay, so now I want you to roll back toward me, and that's very easy. Now I feel it moving in the opposite direction. It only takes about 2 or 3 seconds, and you can go back and forth. Now roll forward. And I feel that softening now. It's loosening up. That's great. And then relax, and now move back in the other direction. That's good. Now I feel it moving in the opposite direction. So now we're mobilizing that joint in both directions.